He has led several hospital projects across different surgical specialties, which enable hospitals to both improve care and generate savings. Will is a passionate believer in enabling efficiencies for a healthier, more sustainable healthcare system. It is Will's belief that industry can continue to play a pivotal role in supporting healthcare institutions to deliver excellent patient care.
My name is William Downey. I'm a Customer Solutions Partner for Johnson & Johnson. I build, design and co-create solutions for our surgeons, hospitals, and ultimately our patients. Value-based procurement is making purchasing decisions based on delivering value outside of just the product cost. It involves making sure that we take costs out of the system, we ensure the best quality care and the best experience for our health clinicians and providers. On top of that, is delivering system-wide savings within the healthcare space. Value-based procurement involves hospital CEOs, healthcare professionals involving surgeons, physios, occupational therapists, and everybody within the healthcare system to be involved in the purchasing decisions to ensure that the best outcome is achieved for patients.
The status quo, what currently is happening, I guess, in the hospital and supplier environment, and I'll be speaking about how we, I guess, are looking into the future around how this relationship can be improved and be seen as partnership. What is the future relationship? The potential hospital and supplier relationship can be better. What if we both focused on the same thing?
Johnson & Johnson and St Vincents worked closely together and essentially co-created a short-stay joint replacement program. This involved using high-quality medical device orthopaedic implants, taking advantage of Johnson & Johnson's consulting service involved in reducing patient length of stay, and also looked at different ways involving change management to help support the hospital to create the efficiencies that they required. The St Vincent's project achieved a reduction in length of stay of just over 1.5 days. What it also achieved was improved efficiencies within the process of orthopaedic care and joint replacement and increased staff and patient satisfaction.
Everybody's hospital group is looking for a different solution, and I'd really urge you to look into discussing that with your suppliers, because it could go from around building digital capability for customers. There are so many areas that aren't explored around digital patient education, around theatre efficiency. Is that a challenge? Is that something that suppliers can support with? There is a variety of areas, and if that's a group goal, then absolutely reach out. And of course I'd have my natural biases around reaching out to Johnson & Johnson, but I think it's a question in medical technology that we have to ask ourselves. Is every time, and I said this in the presentation, is there an opportunity here to provide more value than we are currently giving outside of a transaction? And if that comes from group, if it comes from a hospital, that area for us doesn't necessarily matter. It's about delivering the right outcome for patients in the most optimal way possible.
Working together as industry and healthcare enables co-creation, which is the most critical component for innovation. The closer we work together, the better the result. If we take the St Vincent's program as an example, which per patient delivered savings of $2,965 per patient, and extrapolate that out to 500 patients, that number just comes under 1.5 million. Now imagine if you could do that across states, and the figure you would come up with would be even more considerable. What if industry could play a role in reducing length of stay and helping patients get back to work quicker? Imagine if that could be scaled to help thousands more patients and ensure that our healthcare system remains sustainable. If industry can focus more on supporting patient outcomes and reducing the overall cost of healthcare and the healthcare system, rather than just focusing on the cost of a widget or a product, imagine what can be achieved through partnership.